بسم الله الرحمن الرحيم. الحمد لله وحده والصلاة والسلام على من لا نبي بعده. أما بعد, السلام عليكم ورحمة الله وبركاته. I am Dr Zakaria Guennoun, consultant in diagnostic radiology, currently practicing in Saudi Arabia. Just a quick overview about the T2 FLAIR Mismatch Sign. And before we discuss the details of this sign, a little context. We have to acknowledge that the diagnosis of CNS tumors has drastically changed over the last years. For this, we used the WHO classification of CNS tumors. In 2007, the WHO classification of CNS tumors was based solely on histology. 1 year later, in 2008, there was a revolutionary discovery of the mutation of the IDH in a subset of diffusely infiltrating gliomas, starting a new era in molecular imaging. Fast forward to 2016, and the updated version of the WHO classification of CNS tumors has now introduced genomics, namely IDH and 1q19q code deletion. One of the big changes in this new classification is that grade 4 gliomas are not automatically classified as glioblastomas, and to be called glioblastomas, they must have IDH wild type, so the genomic criteria are really important to characterize tumors. The IDH stands for isocitrate dehydrogenase, IDH, which is a key enzyme in the Krebs cycle that plays an important role in energy metabolism. In recent years, it has been found that IDH mutations are closely related to the occurrence and development of glioma. Yes, dear listener, at last, the arch nemesis of the radiologist, the Krebs cycle, has found a way to link its ferocious and cruel cycle with medical imaging by way of its minion named IDH. And this 2016 classification has remained in the 2021 WHO classification of CNS tumors, and the presence or absence of these two genomic phenotypes will permit to classify CNS tumors in such a way that the tumors which are IDH positive and present 1q19q non-code deletion are considered gliomas with relatively good prognosis, and those with no IDH and 1q19q code deletion will be considered more suspicious for being aggressive tumors, for example glioblastomas. Okay, now that we have put some context and learned about the relationship between genomics and CNS tumors, what does MRI has to do with any of this? Well, there is this typical appearance of a tumor on T2 and T2 FLAIR, which is highly specific for astrocytoma IDH mutant 1q19q non-codeleted, exhibiting a focal T2 hyperintensity appearing as slightly hypointense T2 FLAIR with hyperintense peripheral rim on T2 FLAIR. These genomic features are nearly exclusively found in astrocytomas. These tumors have a better prognosis than those with no IDH features and 1q19q codeletion. Of course, as always, there are some caveats in this sign. Even if it is specific in the adult population, the sign can be found in other instances in the pediatric population, for example in DNETs.